Good morning, everybody. Today is February 7th, 2020, and this is your Wuhan coronavirus update for the day. As of this morning, there has been 31,576 confirmed cases of the novel coronavirus across the globe. There has been 639 confirmed deaths, as well as 1,675 confirmed recoveries from this illness. That lowers the fatality rate from 30% yesterday to 28%, which is a good sign, but I don't believe these numbers are accurate until more cases are confirmed, more recoveries are confirmed, and more deaths are confirmed. This is a very serious illness that needs to be taken very seriously. There are two things that stood out to me in the last 24 hours that are important and I believe you should know about. The first is Princess Cruises. The Princess Diamond ship has been quarantined, as most of you know. What's scary to me is the series of events that led up to this quarantine. Basically, the Princess Diamond left Yokohama, Japan on January 20th. It docked in Hong Kong on January 25th. A passenger departed the ship and he ended up going to the hospital, where he eventually tests positive. The passenger did not return to the ship, but the ship continues on to Da Nang, Vietnam, Ha Long Bay, Vietnam, Keelung, Taiwan, Okinawa, Japan, and finally it returns to Yokohama, Japan on February 4th. All of the passengers disembark, and new passengers embark onto the ship, where it then departs on the same day. When Princess Cruises learned that there was a passenger who had tested positive on the previous voyage, they immediately quarantined all of the passengers on board and went back to Yokohama, Japan. Since then, as of yesterday, 61 passengers are now confirmed infected with a novel coronavirus. This is my question. How many of those passengers are actually crew members who may have been on the previous voyage? We're not sure. How many of those passengers are passengers who had no contact with this individual? We will have to see what happens with this case and how many more are infected, how many more succumb to this nasty virus. But although this may be a tragedy, this may be a blessing in disguise for the world. I believe that this will allow scientists to have a case study on how this virus is transmitted, how long the incubation period is, what types of people are infectious, how they transmit it, if it's asymptomatic or not. Really, at the end of the day, what this means is that one passenger infected up to 61 individuals, and I'm curious to see how many more become infected. This leads me to believe that this virus may be transmitted airborne through aerosol droplets when people exhale. And that brings us to the second piece of news that I stumbled across. The second unsettling report is from Chinese health officials. They state, and I quote, that a man contracted virus in 15 seconds from a stranger. Basically, what their findings was a 56-year-old patient, only known as Patient 5, had no previous contact with animals, and he wasn't acquainted with any of the confirmed cases at the time. Through investigation, they had discovered that he stood next to a confirmed female patient, number 2, at a booth inside a market on January 23rd. The report noted that at 7:47 a.m., patient 5 came in brief contact with patient 2 for just 15 seconds, while neither were wearing a surgical mask. On February 4th, patient 5 was diagnosed with novel coronavirus. This is incredibly scary, ladies and gentlemen. This is big news. If someone can contract this virus by simply standing within close proximity to somebody for 15 seconds, then how do we contain this disease? What is the transmissibility of it? How do people catch it? Nobody really knows. This virus is too new, and it's spreading so quickly that it leads me to believe that, as I said, aerosol from exhaling. Let that sink in for a moment. Of all of those passengers that disembarked on February 4th from that cruise, how many of them had contracted the virus from that man? He was on the cruise for 5 days before he departed. How many of them were not showing symptoms? Are they being tracked? Where have they gone? There are so many cases being reported of individuals catching this illness that have not been to China. It worries me. As localized outbreaks across the world begin to happen and people realize how contagious this disease is, how many people are traveling to the United States and nobody's screening them because they're not coming over here from China? How many individuals are going to enter the United States or Europe or any other country not showing any symptoms, being contagious and spreading this? More and more scientists believe that this virus is not going to be able to be contained, and this virus is going to continue to spread across the world. At the rate that it's going right now, this could be devastating for the world's population, and nobody knows truly how fatal this disease is. When SARS originally broke out and started spreading across Asia and the rest of the world, they estimated it to be at a 3% mortality rate. It ended up being roughly 10%. According to my calculations from the confirmed cases, all of those that are confirmed, it's roughly around a 30% fatality rate. I believe that right now, the governments and the media are trying to calm people down by comparing this illness to the flu and saying that the mortality rate is incredibly low and that it only affects elderly people. More and more patients under the age of 60 are succumbing to this illness quite quickly. We don't know the true size of the outbreak in China. The Chinese hospitals are overloaded and unable to treat people who are affected with this illness, turning them back, turning them away, sending them back home. Are these individuals recovering? Are they dying? We know that the funeral homes and crematoriums are overloaded with bodies. The numbers simply don't add up. My recommendation to you is to keep an eye on this news, keep watching, but start to prepare. There's already shortages of surgical masks across the world, and if this virus continues to spread, especially in Europe and especially in the United States, there will be eventually mass hysteria over the coming months. The only solution for this virus, the only way to contain it, is world isolation, mass isolation. I do believe that soon the governments will be recommending people stay home, not go out in public. You need to be ready for this, and your family needs to be ready for this. What you need to do is you need to begin to stock up on food and water, non-perishable canned goods that can last you at least 3 months. I myself have been stocking up on food over the last few weeks, and I have roughly 2 months worth of food for me and my family, soon to be 3 months worth of food. You need to take care of yourself. If you wait for the government to solve this issue, then you could be really, at the end of the day, sitting at home with no food, unable to get any. For if you go out into public, somebody could transmit this illness to you and you could bring it home to your family. Give it to them. Get them infected before you even show symptoms. Please, for you, for your family, start to prepare. This is your novel coronavirus update for the day. I hope it helps.